Hey everyone, Dr. Rodney White here with Sapi Chiropractic, and we're joined with our special guest today, Michelle Mccaslin from across the hall at Functional Heartland Medicine.
Yes.
Thank you. And today we're going to talk about vitamin D deficiency. It is probably one of the biggest health issues that people in this part of the country face, and Michelle's going to talk about it from a functional medicine standpoint, because most people are deficient and probably don't know it. Is that fair?
Well, that is true.
Okay.
I run labs on vitamin D, and just about everybody that walks through my office is deficient or low normal.
Except maybe some of our patient base, because they know to be taking at least 10,000 units with vitamin K every day.
Awesome. K2 is definitely important with the D3. But typical ranges that I shoot for, which may be similar to yours, is about 80 to 90 in blood. I will find most of my patients are running either deficient less than 29 or trending on the lower end of the spectrum around 30s. So vitamin D is very important because it's not a vitamin, it's actually a hormone, and it affects every cell in the body, all your other hormones. It affects the immune system, and some of the obvious things we know, it affects the bones. So vitamin D in the scheme of things is quite big. And so even though that seems to be a minuscule thing, when I run labs, people are like, oh, my vitamin D is pretty low. I'm like, no, you don't understand. Just like the thyroid affects every cell in the body, so too does vitamin D.
And so a lot of people, they do get this. This is one thing that the regular doctor often checks. It's not just a functional medicine thing, but I've had people come back in and say, oh, I was normal. I was between 40 and 60.
Oh, yeah.
Which is probably the generic rating, right? But as you're saying, that's nowhere near enough.
No.
Especially females getting older, because they lose bone faster than everyone else. So you like to see it where at least 80?
At least 80 to 90, depending on various situations. If somebody is autoimmune or with cancer, I tend to drive that number a little higher.
Okay.
But it's also based on what they tolerate. So it's watching the levels is very important. So if you're doing anything greater than 5,000 international units, I would suggest a practitioner monitoring it, and I do that every 4 to 6 months.
Okay, so that was going to be my next question. People should do it 4 to 6 months. And there is a lot of myths around vitamins out there that you can overdose. I know the only thing I've ever seen with vitamin D toxicity was an infant with 100,000 units at one point. If someone's very deficient, what are some of the highest numbers you've told people over the years that they should be taking?
About the same. 10,000 tends to be a nice standard approach of optimizing their levels.
Okay.
But it is also dependent on verification through labs. And if somebody is still maintaining a low level vitamin D, then you have to consider the possibility of malabsorption.
Okay, great. So if you haven't had your vitamin D levels checked recently or at all, it's not something you necessarily have to see Michelle for, although we would recommend her for any of your lab testing just because of the functional approach. But you can even have your GP run it, and if you are low, then you want to call someone like Michelle and have them help with a plan to get back up to where you should be. So thanks for watching, everyone. If you have any questions at all, leave a comment below with this, and we're also going to always have Michelle's information on all of these videos. You can reach out to her too. So that's all we have today. We'll see you next time.